Hey, welcome everybody. It's time once again for Health Talks with Dr. Trinh. The one show, the only show that shows you the path to a healthier life, one conversation at a time. And today we're going to revive a conversation we've had before. We've got with us apparently Princess Leah. I don't know if Princess Leah is really here or not, but she reminded me that's how she pronounces her first name here. So Leah Johnson, welcome to the show.
Thank you so much for having me. I'm excited to be here.
So I love your background. You look like you're at the top of some high office tower here. Where are you really sitting at?
I'm in San Jose, California.
San Jose, okay. And you're a pharmacist by trade? Is that what they tell me?
Yep, I am a clinical pharmacist and a medical cannabis specialist by trade.
So what is a clinical pharmacist? I know what a regular pharmacist, I go down to CVS and see my pharmacist or whatever. What's a clinical pharmacist?
So they're similar to, truthfully, all pharmacists have the ability to be a clinical pharmacist. It just depends where you're working. So okay. I review patients' medications and make sure that they're safe and effective for what they're using. So that's, if you're a retail pharmacist, you review medications to watch out for interactions before filling them and notify the doctors if there's interactions and to go through insurances. Clinical pharmacists focus more on the clinical nature and to make sure that the drug is correct for the patient for that ailment. So for example, if they have a certain type of blood pressure and you have a clinical pharmacist on the team, they might say, okay, this person has blood pressure, let's put them on blank. And a clinical pharmacist might say, well, their blood pressure is due to an erratic heart, an issue with their heartbeat. We need to put them on a beta blocker to make sure that their heart is beating at a certain level. Or it's due to a kidney issue. So we want to make sure that we put them on something like lisinopril or ACE inhibitor. So clinical pharmacists work more hand in hand, usually with providers to help get the patients on the best regimen possible and to make sure that if a regimen is requested for a patient, it is safe for them to use.
And do you do this in private practice or do you do this at a hospital?
Oh, I do this through managed care. So I just work for my company, and we have requests that come in for different chemo regimens, and we review those regimens to make sure that they are safe and would be effective for the patient. And because a lot of times with so many new procedures, especially in oncology coming out, there's always the chance that, there's a provider that says, oh, well, there's a new drug that came out, let's use that, where the patient might be safer on one of the more gentler chemos that came out, a little bit before. So we usually try to help the doctor and the patient use the safest chemo as safe as chemo can be, right, but the best chemo for their condition.
So would it be safe to say that you're kind of like a backup, a way to review things, to a second layer of protection for the patient to make sure that somebody doesn't inadvertently do something that might cause them harm here? You're sort of another layer.
Yeah, actually all pharmacists are, even retail pharmacists, because for example, I got a prescription one time way back ago when I was a retail pharmacist that said prednisone 5-325. And for those of you that know medicine, prednisone does not come in 5-325. It comes in 5, and Percocet comes in 5-325. So it's like, what did the doctor want? And so we had a call, and it ended up that they did want the control prescription. So the patient had to go get it. So it's really just that second eyes and that's pretty much why, pharmacists could not prescribe for themselves and doctors can't. There's supposed to be checks and balances. That's right. Really what pharmacists are supposed to be. The physicians or the providers will write a medication, and it's up to us to assess the medication and then to dispense it or to approve it for the patient.
And I always say it's the airline pilot analogy. Airline pilots, no matter how long they've flown, somebody has to go through a checklist with them and say, wheels down, flaps up. And the pilot doesn't look around and say, of course I know what to put the wheels down. I've been doing this for 20 years. You don't have to tell me what to do. Yeah, you always got to double check everything here because people are human and they make mistakes. All right, so you do a very precise scientific role. What are you doing messing around with medical marijuana here? This should be way far away from what pharmacists talk about here.
So, well, cannabis is a really interesting concept. And I actually have, and I call myself a specialist because I do have my master's from the Maryland School of Pharmacy in Medical Cannabis Science and Therapeutics.
Wow. All right, I got to stop you for 1 second.
Yeah.
So there is such a thing? Who knew that schools are taking it that seriously and offering master's degree programs in this science of medical marijuana?
Cannabis. Yeah. So it's really, and it's it's a accredited, very well-known school. Most people know the University of Maryland School of Pharmacy. So it's a really great program. And really the idea is that there's been such a stigma on cannabis for so long that people don't realize that, and it's really THC that has the stigma, but what people don't realize is THC is this itty bitty tiny little component of this giant plant that has so many health benefits. So as a pharmacist, we are touted as the drug experts. Well, I didn't feel like I could be a drug expert if I didn't have my background in all of what we consider medicine. And I was an herbalist actually before I became a pharmacist. So I also have my background in herbal supplements. So I think it's so important that all of these components of medicine be understood together for a couple different reasons: to help patients, because there's a lot of pharmaceuticals that are much more harmful than plant medicine can be. So that might be a better option for some people. The other thing too is sometimes pharmaceuticals don't work for certain conditions, like autism is a great example. They don't really, and I worked with many autistic patients with autism spectrum disorder, and what they actually have shown is that they have a deficiency in their natural cannabinoids that they make in their system. So we actually make our own personal cannabinoids that we've always made. But the point of using outside cannabinoids is to replenish what we're not making, because, over time, your back doesn't work as well as it used to. Your arms don't work as well as your eyes don't work as well as they used to. And with that, other systems break down, including our endocannabinoid system. So we are not making what we should be making. So utilizing cannabis-based therapies actually replenish what we're missing. And patients with autism actually have been shown to have a deficiency in anandamide, which is our natural version of THC, but it doesn't cause us that high feeling, but it does make us happy though.
Okay, a lot to unpack there. You threw out a lot of things here. Let's see if we can take this apart and look at some of it. Let's start with a question I have, and this is a little bit of field, but I always wonder, in a world where we're medicating ourselves more and more with herbs and natural products and other sorts of things, we go to places like Mother's Market or Whole Foods or whatever, and we get these supplements, we get these herbs, we get these Chinese medicinal treatments, we get a variety of different things here because we're not sure about what the doctor's prescribing, or we want a natural alternative instead of a pill with all the potential side effects of medicines and drugs, or we're just, taking our health care and I'm not going to take one answer. I'm going to do what I feel is best. All of those things are leading us to put other things into our body, which are natural ingredients, but I wonder how they work with the unnatural medicines that we're putting in on top, the synthetic medicines that we're putting on top. Do people worry about if I'm taking synthetic medicines and I'm also putting supplements in my body? It seems like there's a potential for bad interactions or bad side effects, not because of the pill and not because of the product, but because of the way they work together. Is that ever a concern? You're taking what else you're taking?
Absolutely. That's what I do. That's actually one of the huge things I do with patients that I work with for cannabis therapy is I make sure that we go through everything they're on, all their current medications, to make sure that the cannabis is not going to interact, and I also go through all plant-based therapy and supplements too. it's actually interesting. You don't run into so many interactions from what we've seen. It's not an excessive amount, but it is important to always read labels and to really know about what you're taking and ask. Like, really ask. If you ask a pharmacist, if they don't know, ask an herbalist. If you're going to use herbal supplements, because there are some that can interact. For example, cannabis. A lot of people like to say cannabis interacts with everything. That's actually not true. But there is a handful of, just like any other medication, where you want to be more careful because it can actually raise the levels of other drugs in your blood. And there's actually one drug that it can decrease the levels of your blood. So you actually need a little more. So what it really comes to is just monitoring and making sure you have somebody that you can ask and reach out to ask these questions to. Most herbalists especially should be able to help you with the interactions, and pharmacists as well.
Do we ever test the interaction? They test sometimes the interaction of drugs, or when they did their clinical trials, they see what kind of side effects. Do we ever test cannabis and other sorts of things to see what potential side effects or interactions?
Oh, absolutely. So we know, for example, clobazam is a seizure medication that's used for patients with epilepsy. It's used often for epileptic seizures. And what you'll find is that Epidiolex, which is a prescription medication, but it's pretty much a isolate that's been extracted of CBD. So that's what Epidiolex is, and it is a drug on the market. And what was happening is they would start using Epidiolex for patients with refractory seizures, but then they started seeing the level of the clobazam slowly rise in the blood. And you don't want blood levels, of course, to go up unless that's what you're looking for. But what they realized, though, is there was less side effects with the cannabis-derived meds than there was from the clobazam. So what they realized is they could just reduce the level of clobazam a tiny bit. And actually it was better. They used less of the medication that caused side effects. And also the Epidiolex actually helped the benefit of how well clobazam was working for the patient. So there are interactions, but it's really understanding how to handle the interactions that makes the difference.
Right. Well, you've answered one of my big questions, because I wonder, we're popping so much into our body here, natural supplements, herbal supplements, plant-based things, and on top of it, we're still taking synthetic medications. And I sometimes wonder what happens out of this cocktail of drugs that we're putting into our body here. Does anybody really understand or even monitor? And you said, yes, that's the pharmacist's role to really do that.
That's really what we should, and people, I think, don't realize. I mean, right now there's sadly a big situation going on in retail pharmacy, which I actually support my fellow pharmacists with what they're going through. But traditionally, the best people to ask about interactions, about herbal supplements, about over the counters, especially, and meds in general, is really the pharmacist. And I find a funny catch-22 where the doctor usually doesn't, says, here's your med, and walks out.
Right.
The patient says, well, obviously, if I had to know anything important, side effects wise, the doctor would tell me.
Right.
The doctor knows that the pharmacist's job is to explain interactions and stuff. So that's why at the pharmacy, they say, do you have any, the pharmacist would like to talk to you. They say, oh, no, never mind. The doctor would have told me. And the doctor's like, no, I don't know what the interactions are. That's what the pharmacist's job is.
Exactly. And I hate to admit it, I don't think I've ever asked my pharmacist other than hand me the pills. I've never asked them maybe a question of how do I take it? Do I take it with food or whatever, something here? But I rarely ask them anything, and I'm not sure that they ever look and see. They just hand me the pill. Do they really look at do they have access to my information? See, he's also taking these things. Have I told them I'm taking cannabis perhaps, or other sorts of supplements or something? I may not communicate that to my doctor even. So everybody is acting as if somebody should be checking this, and I'm not sure that there really is a coordinated effort to check these things sometimes. The doctor, the pharmacist, and me.
Well, in retail, that's actually the number one job of the pharmacist, is all the meds that go into that pharmacy, they see everything.
Right.
And so the pharmacist doesn't, everybody thinks that pharmacists are pill counters. We actually rarely count the pill unless we're behind. What our job is to do is to really go into the request clinically and say, oh, this doctor just recommended this, let's say, I don't know, let's say this cholesterol medication.
Right.
And that cholesterol medication with a different cholesterol medication the patient's already on can cause a lot of side effects. And our job as pharmacists is to catch, as retail pharmacists is to catch those side effects, say, hey, doctor, you wrote for this. This is going to cause some issues. I don't recommend that these two be taken together. This is another alternative. And then the doctor then will recommend what to go, what they would like to do from there, or the provider. So that's where the pharmacist checks and balances are. Now, mind you are completely right. If you don't tell the pharmacist that you're using a different pharmacy, and we can't track that. Right. If you don't tell a pharmacist you're using herbals, we can't track that. If you don't tell the pharmacy you have a question about meds and they didn't think their doctor told them, we're not going to know. So really the best thing to do is really ask, is just say, do you know anything about my medication with cannabis? And you should never be afraid. I mean, and I always say this to all my patients, if you feel you cannot be honest with your doctor or your pharmacist about what you're taking, you need to find a new pharmacist and doctor. And I don't mean to be rude, but I say that because you should trust that the people that are watching your meds are protecting you. So if you say, I'm a medical cannabis user and I want to make sure it doesn't interact with my meds, that pharmacist or that doctor should say, sure thing. I don't know personally, let me see if I can find somebody who can can check that for you.
And yet we probably don't tell them that, maybe because we don't feel there's a lot of time. And actually I'm standing in line. Do you want to go see the pharmacist? No, I'll just take the pill. Or maybe there's an embarrassment, or maybe I'm going to say it out loud. I'm a medical cannabis, and 3 people in the room are going to go, what? I mean, I don't know what we think is going to happen, or the pharmacist is going to look at you horrified and say, you're doing what? You're a drug user or something here.
That stigma is still there, and it's been kicking around for since 1933.
Yeah,
so
they're going to go back in the back room and call the cops or something here. Police are going to arrive.
None of that will happen, especially not in California. We are all, to be honest, if anything, the providers and practitioners are getting to a point where they're like, we're deficient in our knowledge of medical cannabis, and we need to learn this.
I wonder if that's true. I mean, I believe that's true. I don't have any proof of that, but I instinctively wonder. It's like nutrition too. Dr. Trinh always talks about nutrition, and nutrition is obviously an impact. What you put into your body impacts how your body reacts, not just pills, but food and sugar and all these other things, and caffeine and whatnot that we're sticking into our bodies constantly here. And I wonder somehow if we don't need a broader knowledge base, not just we, but the doctors, the practitioners, and maybe the pharmacists too, on all this stuff that we're consuming. It isn't just the pill, and here's how to take it, and here's what its potential side effects are. It's all the other stuff that we're sticking into our bodies here too. Starting with food.
And food is just such a huge concept of it too. I was actually just at a national conference, CanMed, where it's literally a whole conference about cannabis research and studies, and it's all about learning about, on the medical side, the benefits. But what we learned there, though, was that a lot of patients have actually been transitioning to plant-based therapies, plant-based diets. I'm sorry, actually the whole diet is just plant-based. And I was talking to an herbalist there, or a botanist, there, who really his full background is how the body has changed with the different intakes over time. And what we're really seeing is, we were back in the days when we were hunters and gatherers, we were very, very healthy. Of course, situations were much different.
Right.
But what they found is, over time, we're pulling away from fruits, we're pulling away from vegetables, we're pulling away from plants, and doing a lot more of the prepackaged stuff that doesn't have that. And what we're finding is that a lot of the vitamins we used to get in nutrition was all from these herbs and vegetables and fruits that we just kind of have stopped eating as much over time. And what we found is that when people go back on a plant-based diet, a lot of people do phenomenal, and I've seen patients all of a sudden that have had diabetes and amputations due to diabetes. Now, I mean, nobody's really off of diabetes, but completely in as close to remission as you can get from diabetes, and didn't have to take any meds, and he was just doing fantastic, except for his few toes that he lost due to the diabetes. So I think it's amazing. And I think with time we are moving and we're shifting to more plant-based, but I think that also more research is starting to come out for that, which I really am a huge supporter of. I think the more we can know, the better we can do to treat everybody.
So I'm going to ask you one more of my pet peeves. Everybody wants a pill, and me included. I got a problem in what I eat. I got a problem in what I exercise. I got a problem, therefore, in my heart or my lungs or my diabetes. Just give me a pill. I don't want to change my behavior. I don't want to change my diet. I don't want to change and have to exercise and do all these other things. Just give me a pill to make the darn thing go away, and I'll continue to do what I've done before.
Yep.
And I think that comes down to, I always wonder about vitamins. Everybody says, well, take a vitamin, it can't hurt. I wonder if it really does help, or are we just peeing it all out? Are we saturating, we're putting a ton of vitamin C in our body, and our body can only absorb so much, particularly in this pill form, and most of it just passes out of our system here, as opposed to if I ate 52 real oranges rather than taking 52 milligrams of vitamin C. Is there some truth to that? I mean, clearly the more we really consume it in the proper form, the better it is, but can we make up for it with this deficiency with just a pill?
Well, yes and no. Really, at the end of the day, I always encourage for, if you, as natural as you can go that way, because, you know, like you said, why get vitamin C from a pill when an orange is not only going to have vitamin C, it's also going to have fiber. It's going to have all those other benefits for it. So you kind of get, you know, like you were saying, one pill to do everything. That's kind of what your fruit is. It's that does everything.
Right.
But you can absolutely help where you are deficient. There are certain times, like certain areas you don't get sun, you know, vitamin D supplementation, some of that, you know, is needed. So vitamins are beneficial, but I always say use pills as your kind of last line if possible. So the way I usually go for it is I usually go for fruits and, you know, for regular food first, then, you know, move on to, if I'm needing something, you know, an herbal based thing, such as like I take ginkgo biloba ginkgo biloba every day. And the reason,
do you take it in a pill form, or do you take it in a powder, or do you take it in a plant?
Ginkgo biloba, it's actually, I only go with natural, like full extracts. And the reason I do the extracts is because you're extracting the components, the active components of the plant. So I use a 120 milligrams standardized ginkgo biloba product. And that's why I actually was laughing, because ginkgo biloba is for memory, and I was tripping on the name. So I laughed about it. But truthfully, it's actually, I was taking it all through pharmacy school, was retaining everything well, stopped it for the year, for a full year after pharmacy school. And I kept doing this, like, you know, that thing. And I noticed when I started it up again, after about a month, things were I wasn't doing that anymore. Things were just, oh yeah, that's right. And oh yeah, I remember this. And it's really, the way it works is just it gets glucose to the brain faster. So there are benefits to the herbals. And then, like I said, so start with eating healthy. If you eat healthy, but you still have something, move on to herbals. If the herbals aren't helping, move on to pharmaceuticals. That's just how I mentally see it, because the more natural to the less natural, our body can handle this better. Our body can handle this not as well.
Right. I think that's a sound advice, and I probably would adhere to that. And I've never heard it described that simply. Start by ingesting the best you can, and then maybe supplement it with the purest herbals that you can find. And then maybe if you still got problems with diabetes or cholesterol or whatever, something here, you know, then turn to the pharmaceuticals, because they have power, they do work, but they have side effects and other problems attached to them here. All right, so let's go back to the full circle at the beginning of this here. One of the Wild West problems that we've talked about many times in the show is, I think it says cannabis. It's supposed to be cannabis, but I don't know when I buy it really what's in the darn thing. It could be other stuff that they didn't tell me is in there, because it's not FDA regulated. It might not be the dose that they say it is. This is so much, and if it really got tested, it's not so much. I'm not saying they're all lying and cheating, but it's the Wild West. Some are great, some are not great. Some are packaging this stuff overseas and there's not a real good control or a real good measurement or whatever to it, and maybe other things along the way. Dr. Trinh deals with this because he's got the CBD Council, where they really try and offer their services to stamp and say this has been certified. It really is what it claims it is. But in a world where this is not regulated, how do I know I'm getting good stuff when all I'm doing is just dealing with the marketing here?
So it's actually twofold. So in the state of California, you can, if you dispensary products, you can pretty much trust. Right. They are regulated. They have to be, not by the FDA, but they are obligated. Every single one needs to be tested. Every single one needs to be reviewed. And there's actually a process in the state of California. There's a process. Every single cannabis product formula company, including flower. So the flower, so like the raw material has to be tested, all the gummies, all of the edibles, all of the liquids, tinctures, all of that has to be tested. And they actually have to always provide a certificate of analysis per batch of their product. So it's very similar to anybody who knows good manufacturing practices for herbal supplements. Not saying that these are herbal supplements, of course, I mean, they actually are, but in the government, they are not considered herbal supplements. Right. But that's what they do. They actually go through a rigorous test. And if they don't meet the lab criteria, they actually can't have it. Like, so if it has mold, they test it all for safety. Yeah. And they make sure if any of that's in there, they actually aren't allowed to sell it to dispensaries. And dispensaries do check the good dispensaries, which are most of them, do check, because they could lose their license if they find to not be doing these protocols. CBD, that's the other fold. It is. And I've actually just started working with a company as their medical director to get the best CBD based products for patients, because it is such a crapshoot. There are some really phenomenal CBD companies that PCC has vetted. The physicians
Cannabinoid Council.
Cannabinoid Council, yeah. Right. I'm in another organization that's PCCC, so I always twist the two together. But yeah, so it's there are some great products, there are some great companies, but the majority are not, and that's really the biggest thing.
They're
and that's
just
actually
profit driven. They're out to fill a hole in the market and to do it as quickly and inexpensively. And maybe they cut corners. Maybe they don't even care that they've cut.
I mean, there's products out there that have been tested that say CBD, and it says whatever amount they get tested has like no CBD in it. Yeah. There are other products. The other issue with CBD products is the synthetics that are being created from them. So because they're not found in the plant, so we have no studies on their safety and efficacy. So, but people are using them, and we actually found that one synthetic that was being made, which was THCO, when it was inhaled, it was causing the same effect as the Avali, which was what was it? I believe it's e-cigarette. It's pretty much the ailment that came about with all the CBD vape heads coming out, where they were putting vitamin E oil into the product. Right. So what happens with THCO? Same thing. You get that acetate formation, and it's lung damage and cause pneumonia and a lot of other issues. So I get more nervous I like plants as they are. Yeah. Plants are safe, and as long as we don't mess with them, we're okay. I find that as soon as we start adding heat and acids to plants, they're not what we were looking at before, and they might no longer be safe. Yeah.
And that's very troubling and worrisome. So we think we're doing something good. We go to aisles of these products, and the hourly employee doesn't know, hey, dude, try this one. Hey, how about this one? I don't know why I said, hey, dude, but they all seem like they're 12 or something in the center. And you're trusting them because they've anecdotally either tried it or somebody has told them about it, but they don't really know. And the shelf is just stocked with these things, and I got a whole wide range of them. Some of them start, well, I might as well take this one because they threw in vitamin C or vitamin E or vitamin D, and they put in 20 other things. Boy, I've got the one magic pill. I came for this one compound, but they threw in 50 others. That's more sounds better. And we end up buying these things as a marketing thing, and it may, in effect, you're saying, actually not be what they said it was at all, or it may be a combination that really doesn't work, or maybe it's even a bad combination.
Yeah. or even harmful like that for you. So that's why it's the best thing to do, I say, is stick with what we are currently testing, which is what you can find in a dispensary or a reputable location. We actually see the same. That's actually something else we see in the dispensaries, because we don't have healthcare professionals in most dispensaries,
Right.
especially in California, is that the education to the patients. Now, if you're in a dispensary and you want to use flower, that's fine. Most people don't need somebody to discuss with. But I have had many patients in the past who have come to me after going to a dispensary saying, I have trouble sleeping. I heard you can get me something really great for sleep. And then they go, oh, yeah, here's a gummy. And so they say, okay. And it's, even a 5 milligram gummy. And they're like, okay, I take the gummy like an hour before bedtime, just like you told me. And then they are just like up all night, think like they're paranoid, freaking out. And it's just 5 milligrams. Everybody's like, it's just 5 milligrams. It's like, well, and the biggest thing is a lot of dispensaries don't know starting doses. So really, I always educate to patients, if you're going to start for the first time on cannabis, I would always start between 0.5 milligrams. That's 0.5 milligrams.
Right.
All the way to 1 milligram. Because pretty much at 1 milligram is when people might start feeling something. Mm-hmm. So if you start most patients don't really feel something on 1 milligram. 2 milligrams, you might start feeling something, more of the euphoria. But then, and with CBD, I always like patients to start usually about 10 to 20 and then go up from there. But the THC level is really huge. And so really, if just starting on cannabis, people really shouldn't be using more than 1 milligram at max to start until they know how that 1 milligram affects them.
That tried and true saying, start low, go slow. Don't just jump in and say, oh, good, I'll take a bunch of this and see what happens. And all of a sudden your body's shocked or you have some reaction or whatever here.
Exactly.
You're uncomfortable. Not that it's probably deadly, but it might be disarming or discomforting or not something that you want to experience here. I think we're just touching the surface of all this. We see the benefit in these plants, just as we do in herbs and other medicinal things. Because after all, somebody told me a long time ago, most drug development companies start with a plant. They go out and try and see what benefits. They're actually combing the jungles looking for plants and maybe talking to traditional healers that have been giving this to people for 1,000, generations or something. And then they try and take that anecdotal evidence and they try and see, well, is there something to it? Can we isolate it? Oh, I see this does have some component and this seems to do that. And then they pull that isolated piece out and they patent it and they turn it into a drug and they sell it for some purpose. But quite often they're not just sitting in a chemistry lab mixing different compounds to see what happens. They're starting with some plant-based solution and then trying to find a way to patent it and or perfect it or enhance it, right? Am I right about that?
Oh yeah, absolutely. And what they've actually found, and this has actually been found time and time again with the cannabis plant, is that taking the things out of the cannabis plant causes more of a problem with what the end product is.
Yes.
I always explain the plant's happy. It's alive. It's happy. It's functioning. It's doing its thing. So when we ingest the plant in that form, it's already balanced when we're taking it. If we say, well, we're just going to have this one property, it's just like me saying, well, I don't want you to function as a full human. I'm just going to take your eyeball. So that's all I want from you, just your eyeball. It's like, well, the eyeball is great, but without the rest of the body, the eyeball is useless.
Yeah, right.
or a lot less effective. So that's what we've found about, they call it the entourage effect, but when the plants used together, and that's why I always promote that product should be whole plant, full spectrum, meaning that you go to the plant and you go, I'm going to remove everything I can from you that's not plant material directly. And you got all the polyphenols, the cannabinoids, the terpenes, all the health benefits of the plant. And there are others who will just do THC.
CBD, or I'll take the THC out. And we've had a lot of discussions about this entourage effect with both pro and con, where there are people saying, no, I want to take that one little thing and magnify it, the CBD, the anti-inflammatory thing. So I'm just going to focus on that. Or I'm just going to take this THC out because that means I can sell it over the counter and nobody gets high from it. And yet there is a balancing effect. And when they start tinkering with the plant, pulling stuff out, or focus, or just focusing on one component and not the full range of what's there, maybe it doesn't work the same. Maybe it doesn't have the same effect.
Actually, it's the opposite. That's what people are getting wrong. And that's actually why a lot of patients are going for very high dose THC percentages, which is not the way to go. People, even those who are doing it to get euphoric or to get high, they're buying these high percentages. And what they don't realize is if you go up in percentage for THC, you're going down in other percentages. And what they found is actually when people go for just the THC or even just the CBD alone with no others, they actually need a lot more THC and a lot more CBD to do the same effect as the combo. And a great example is there are Cann is a great product. Cann, CANN. It's a beverage. They have a 5 milligram drink and they have a 2 milligram drink, both THC, but the 2 milligram drink also has 4 milligrams of CBD. So the CBD combination has a lot, over half less THC, but you actually get more of a relaxation effect from that 2 milligrams than the 5 milligrams because it has the CBD as well. That actually enhances the effect of the THC.
But again, we're the type that if we hear one part of the plant is perfect, one part of this compound is what everybody's focused on, the research, then give me more of that. More has got to be better. We always think more has got to be better. And maybe it's more in combination with something here. You're saying that you can actually take less, but in balance with other things, you'll get more of the effect you're looking for.
Absolutely. And that's actually what we're finding I've found with all my patients with cannabis medicine is that by being on cannabis medicine for A or B, they're actually able to decrease other medicines that they're on because cannabis, what it does is the endocannabinoid system is what cannabis works on. Right. We have that system in our body, and all that system is really just a traffic card going, okay, bring the messages. Oh, no, stop right now. We don't need any more of that. It's literally just the traffic guard of our system. So what happens when your traffic guard gets a little older, gets a little run down, maybe didn't sleep
sleeping
well
on the
last
job
night.
Here again. He's not paying attention. Something snuck through. Yeah.
Exactly. And when that happens, all of a sudden your signaling goes crazy. You've got either so many messages saying, help me, help me, help me, help me. The traffic guard's like, I'm tired. Like, give me a moment.
Right.
And so that's where the cannabinoids coming in to supplement. And I always say that cannabinoids, in my opinion, are very much like providing insulin for patients that cannot make their own. I can't make my own, so I'm giving myself more. Right. Same thing. I can't make my own cannabinoids. My endocannabinoid system is shot from the drinking I used to do, working my job that was in a factory, all these, the environment itself. In general, stress is the number one that messes up our endocannabinoid system. So that's actually why they actually just replenish what we've been missing to rebalance us so our signaling goes back. So, well, if you think about it, if we're not fixing our signaling, we're also fixing our signaling for how our blood pressure works. We're fixing our signaling on how our anxiety works. We're fixing our signaling how our mental capacity works. So it doesn't fix the problems as much as it fixes the system for the problems.
Here's a strange question, but so you're talking about balancing your system. How do we know that I'm out of balance? I can test for insulin and see that my body's not producing insulin. How can I test and see that my endocannabinoids are asleep at the wheel or not producing? Is there a test to tell me I need more of this?
As far as I know, we could probably test for a deficiency of certain components, such as we could probably, so there's FAAH is a molecule that actually breaks down the cannabinoids, THC and CBD specifically. And so now if we see a large amount of that in a person's system, we can assume that the endocannabinoids are not staying in there. If we see a huge, deficiency of them, then same in the opposite, there's a good chance that you might be overproducing and overusing the cannabinoid system. So really but the best thing to do, and that's why cannabinoids are always a good thing, is always beneficial often for many people to start with, because if you're using cannabinoid medicine at a proper level, you don't get any euphoria for it. That's never the goal. And the funny thing is people will say will comment about cannabis, but it's like, the high is actually a side effect,
Mm.
truthfully, unless that's what you're going for. But like no
Right.
different than Percocet. You don't I mean, I know tons of people. I was on Percocet when I broke my ankle, and I can tell you I was high.
Yeah.
I thought I was invincible. I thought I could drive a car. Good thing that somebody was monitoring me and made sure I did not. But it makes you high. So it's not, and that's because it's too much for your body. It's more than what your body needs.
Right.
So when it comes to just basic anxiety, depression, pain, especially insomnia, you use enough cannabinoids to help your body refigure out those signaling,
Mm-hmm.
and then your body handles it and brings you back to your equilibrium where you need to be. Now, if you are, you know what, I am fantastic, I have no health problems, I am happy, calm, always feeling good, never in pain,
That's
my
me.
brain's
I'm just perfect. We're all.
I'm just perfect.
Yeah.
Yeah. Like I've never heard of that.
Right.
But if there is somebody out there, then you most likely have a balanced endocannabinoid system and don't need to do anything for it.
Right.
But the majority of us aren't. And pretty much if you have some ailment, there is a potential that that cannabis can be beneficial for an ailment, for multiple ailments. And because in general, they work to balance, not to fix this or fix that.
Right. Well, I guess I'm just wondering, again, I'm back looking for the science, the instant answer. Plug in my body's a computer, just plug in the computer like they do at the car shop now. Oh, there's the problem. Oh, we just got to balance a little more motor oil. We got to put a little more brake fluid in. We got to put a little more cannabinoid thing in here. Oh, pump it up. Good. You're good to go. Drive off. I mean, that's the kind of magic solution we're always looking for. And yet it's kind of hit or miss. It's kind of try this until balancing is not an instant equation. It's not an easy stasis to find here.
Oh, absolutely. I mean, and that's why I hope they do come out with tests that actually can test your anandamide level and your 2-AG level to get an idea of how are these in your body. Maybe test your receptors to see how many receptors are you currently showing. Are you all down regulated, meaning do they all pull into the cell so they're not even usable? You know, I think that would be great. Testing would be huge. And that would also then be able to show directly how the cannabinoids being replenished are actually helping the system.
Yeah.
So I'm totally on board with you. I think that would be amazing. But for now, and that's what most patients say to me, well, what dose? And I'm like, every patient is different. And
Right.
what I start Mama Jean on and what I start like Betty Joe on, they're not going to be the same.
And not just because
their
their body is different, but their level of balance is different too. That it's not just how they process, but they may be at a different point. They almost guaranteed are. We're not all down 10% or 2% or 9%. We're all at some unknown deficiency here, and then you got to start tinkering with doses to see when it dial it in, when you get it to the right level here.
Absolutely. And that's what I do with patients. So when I work with patients, we go through all their history. I go through all their meds, their labs, their blood work. I go through everything. And then based off of that, I figure out what the best starting dose is and which cannabinoid profile, like which ones, would be better for them. And we start with that. We start low, we go slow, and we only up it just very slightly. And then once the patient says, I think I'm feeling pretty good, we stop. We stay there. We don't go any higher. People like to, like you said, people loved more is better.
That was good. Give me more. Yeah.
Yeah. But the answer is once you hit a good place and you feel good, it's okay to stop when you feel good.
Yeah. Right. So here's another strange question. We've had people on who deal in Chinese herbal medicine and Chinese traditional medicine. And in that, they look to outward signs. I think they look at your tongue and other sorts of things and try and see if there's spots and other. They look for visible, not just what you tell them, here's where it hurts or here's the problem I'm having, but they look for visible signs. Other diseases, we do a show on pancreatic cancer. If you start getting a jaundice in your eye, that's a sign you might have pancreatic cancer. There's outward things. Are there outward indicators when you see somebody, oh, I think there's your problem. I think that might be what you're missing. Or is it just tell me how you feel and let's give you some of this and see if it makes it any different?
It's like a mix between both, I would say. I think, but it's no different than how maybe somebody would see somebody limping and say, oh, they need something, or see somebody who's screaming at somebody else at an airport. And you're like, oh God,
Maybe you
they
need to
need
calm
some.
down.
Yeah.
Yeah, right.
So it's less by certain tiny features. It'd be more by an ailment, really, just
Behavior.
having that ailment. You know, if you're anxious, cannabis can be effective because it can balance that system. If you're depressed, same thing. You know, same thing in pain, insomnia. But again, but they work because of the system, not because they treat those specific ailments directly. So it's really just saying, hey, you've got this wrong with you. You might have it. There's a good chance you have an endocannabinoid. Pretty much everybody has an endocannabinoid dysfunction. And like I said, unless you're doing amazing, and then God, more heavens, more power to you, and that's amazing.
I'm just wondering because so many patients, I've had that experience in my life where it's like, I don't know, I just feel lousy. Well, define lousy. I don't know. And then you start saying I can't sleep or I have no energy. But it's not real specific. You know something's wrong, but it's hard to describe it. And so the doctor's like, well, if you can't describe it, I can't diagnose it. If you don't tell me, and I'm wondering if there's any other visible signs or symptoms or whatever that they would use to say, okay, you're saying something very generic. I don't feel good. Maybe this is a sign that there's I can help you figure it out. Or is it just, I don't know, you got to be more specific or I can't help you.
Well, like I said, anytime there's pretty much any injury, when a patient isn't feeling good, they're not stable. If they're not stable, their endocannabinoid system's not stable.
Right.
So it's almost never wrong to try a cannabis medicine for different ailments, depending on the ailment, of course, and the dose that's being used. Obviously, for things like cancer, the doses are much higher, they're much different, and they are different. They're comprised of different usages, different formulations. But for general things like insomnia and pain and anxiety,
chronic conditions that the doctor goes, I don't know, so you can't sleep, so you're anxious. I don't know, here is a pill, try this.
Exactly. So I always in those situations recommend cannabis first, because cannabis can help your anxiety, your pain, and your insomnia. So why
Three
take
big ones, right?
a pain pill, an anxiety pill, and an insomnia pill? Not to mention all of them cause negative side effects.
Right.
Cannabis at a level that's low enough that you don't get the euphoria, you rarely get very many side effects from it. Mm-hmm. So it just kind of, if it's made of a whole plant, full spectrum, of course. Just want to say that again, because it's not an isolate.
Right. So you're not big on all these isolate products they're taking one little piece of the, I don't know how many different cannabinoids there are, how many different compounds there are in a plant, but they keep identifying new ones all the time here. And I'm just going to, because that one has some potential, we're going to pull that out, throw the rest of it away, and you're going to get 80 billion doses of vitamin C. You're going to get 80 billion doses of this perfect isolate, this little compound that might have some benefit. We're going to pull it out and give you tons of it.
Yeah. We've seen, so like, for example, when you look at the levels of Epidiolex, which is the CBD that's been isolated from the plant. So right. It is natural. It's not made synthetically, but it's an isolate still. Right. It's just Epidiolex pretty much. It might be, I could be wrong. It might be more of a distillate, which just means pretty much two things. Right, still right. Same concept.
But it's not the full range of products there.
You're not getting that full synergy that you would want from the plant. So from what I've seen, if you look at the doses that are needed for seizure to stop seizure response, it's a high dose. Mm-hmm. I had a patient that had seizures that were refractory to the point where the doctor was about to cut into his head. They was actually the neurologist said, he's a 9-year-old boy. I know we don't want to do surgery, but nothing's working for him. He keeps having seizures. He also had autism spectrum disorder or has autism spectrum disorder. It's time to cut into his brain. And so that's how she found me, was my doctor wants to cut into my 9-year-old son's brain. I'd like to try cannabis first. Yeah, right.
I'll try anything before we do that. Yeah. Yeah.
So she got a recommendation from a doctor so that she was, safe to use it for her son. And we worked together, and I mean, for the autism, it did wonders. I mean, he hugged her for like the first time, which is just, mind blowing for people who don't know, that don't have relationships with people.
They're resistant to every sort of input and feeling.
And combative, resistant and combative. So not only would he hug her, but he actually started crawling into bed and to cuddle with her, which is just mind blowing. But on top of that, he was on, 20 milligrams of CBD and 20 milligrams of CBD and 1 milligram of THC 3 times a day, and no seizures after we started working together. He was doing fine, but 20 milligrams of CBD, that's nothing versus the hundreds you use per dose of Epidiolex, which just to me shows it's better for the patient to use the whole plant. A little bit of everything makes each work better than if you use one alone. You have to use a higher dose, which causes then more side effects.
I'm certainly not somebody who looks at medical research, but I have seen more and more stories about cannabis being used for epilepsy and seizures. And I think there was something in, like, I don't know, 2020 or 60 Minutes or something about a mother who actually moved to a medical marijuana state because she just found that her daughter or son or child couldn't handle anything else but this, and that was the magic cure they were looking for, help to give them some relief. What's still needed? Because nobody's ever asked me to look at my, I have diabetes, and I'm not diabetes, I have, what's the opposite? High cholesterol and other sorts of things here. My doctor's never, ever said, hey, maybe we should look at your cannabinoid system here. I've never heard those words come out of any doctor's mouth. Do they still not understand it? Is there more training that's needed on their part? I'm not even sure they still accept or realize there is a cannabinoid system, most of these doctors.
I think most providers and like healthcare professionals in general do not know that we have an endocannabinoid system.
Because it wasn't discovered that long ago, and I'm not sure it's still, didn't go through med school, but did they teach this?
Oh God. Oh heavens. No. I've spoken to many doctors who are now in cannabis, many doctors, nurses, pharmacists. We literally kind of got together as a panel to be like, did you, well, I didn't do it. No, you didn't eat. Okay. And we were just kind of chatting about how, like, so when it comes to this was in pharmacy school, we learn more about meds than any other type of school because that's our forte.
Right.
So in our school, we had only one day of herbal supplements. And there is, as you know, from the traditional Chinese herbs, there's so many, you could spend months just talking about them. But so we did one day. And in that one day, we had one line. Cannabis can be used as a medicine. Okay, next topic. Right. It's like, great.
How?
I feel so prepared now to go out there and educate on this.
Yeah.
So all medical schools, pharmacy schools, nursing schools, they're not teaching it because they don't understand. They don't even understand. The schools don't understand because the whole thing is that I was speaking with somebody about this recently. The issue is they put the cart before the horse, and that's what's caused the stigma. The THC came before the endocannabinoid system.
Right.
That doesn't make any sense. What happens is we have the endocannabinoid system, and here is a molecule that can affect it.
Right.
That's how we should be seeing this. That we have a respiratory system, and here is how this this inhaler can affect it.
Right.
But we never saw cannabis on the endocannabinoid system level. We saw it backwards from the THC level, the dangerous, evil THC level.
Right.
And obviously I'm being facetious because I don't feel that way about it at all. I think it's quite helpful for many patients. So I think that we should be teaching the endocannabinoid system at a minimum because we make our own endocannabinoids and we should know what our body is making. I still think a lot of research needs to come out, but I will say there was a lot of providers and practitioners before who were just, it's illegal. Do not talk to me about it. I do not want to hear about it.
Right.
I feel like now they're saying, I think I need to start educating myself on it. So they're not there where they know the stuff yet, but they're at least willing to hear it at this point, which is great. We're getting there.
But so again, you're asking a physician to give you, and more of them want to see themselves as holistic physicians, and I'll take a look at your whole thing. I'm not just going to, that's your knee, let's just fix that, and that's not understand how you keep damaging your knee or what your diet is or what your exercise is or what. Let's just get in and isolate that little problem, and we just keep fixing it over and over and over again here, rather than trying to get to the core of it and understand what's causing this over and over again, why you keep coming back with these same things here. If we're moving in that direction, it would seem that physicians then have to what? Teach themselves? Because the medical schools they went to 20 years ago, 10 years ago, probably weren't aware of this, probably didn't teach it, and probably gave them no understanding about it whatsoever.
So there are actually great organizations. There's actually the Society of Cannabis Clinicians, which is a giant organization. It's nationwide. They're actually having their first conference on September 2nd. I believe it's remote and in person in California. I think it's in California.
You can take, ginkgo biloba will help you remember those things. I don't know if you know
I have to be honest. I haven't been taking my supplements in about 3 weeks because I went on vacation, and I'm feeling it. Like I'm telling you, I'm feeling the fact that I haven't been taking my ginkgo. So, but yeah, so there's great organizations, but I think the biggest thing is that, at least from what I've noticed, most providers and practitioners learn what they learn at conferences. So I would really encourage national organizations to start promoting cannabis education at your conferences. And I know my organization, we always, myself and my organization have spoken at many organizations. So California is getting a lot better, especially since we actually just approved the use of medical cannabis in long-term care and hospital facilities for hospice patients and palliative care. And the government went, yeah, let's do it. But without giving any policies and procedures. So we stepped in, the Pharmacist Cannabis Coalition of California, which I'm a board member of. And we stepped in and we said, well, let us make policies and procedures for you so you can feel comfortable. So I have a feeling what's happening is people are like, I'll get to learning about cannabis when it's, there. I don't think people realize how quickly it's going to be there and then how far behind they are. Yeah. So I always say, I encourage national conferences, have cannabis speakers. If you are a provider or a practitioner, look into SCC, look into any medical cannabis organization, and take the courses and really learn, or reach out to me, and I've got free material that will teach you guys a lot.
So how do we do that? Give us the websites. You open the door. Let's answer the question.
So the best place to reach me is LinkedIn, and you just put in my name. You have to put in DR for doctor. So Dr. Leah Johnson. So just DR period, Leah, Leah, and then Johnson, Johnsson.
Okay. Because, and I say this to physicians all the time, if you want to stay at the center of my health conversation, if you want to be seen as the gatekeeper, the first person I come to who then directs me to others, then you have to have a full range of knowledge. If you're just going to come and say, I don't know, or why don't you go see somebody, or why don't you take this pill, then I'm going to stop coming. I'll come when I break my leg. I'll come when I have, something I know you can treat immediately. I've got measles, I got mumps or something here. But I'm going to stop coming. I'm going to start searching for others, alternative practitioners, or my own education. I'm going to be my own. And that's a dangerous place to be, because you're asking me to know a lot about things I really don't know. But I get there because I'm not comfortable with the 5 minutes I get with my doctor and the 2 standard answers they give me every time I bring up something here. They don't talk about exercise. They don't talk about diet. They don't talk about endocannabinoids for sure. And if they don't talk about a full range of solutions, then if they're just the pill prescriber, then I'm going to go to them only when I need a pill.
Yep, exactly. So, and I'm happy to talk to any practitioner, provider, or patient about the endocannabinoid system or cannabis medicine. My biggest focus is I have the information, and I would love to, and that's why I'm so thrilled to be here on your show, because I just think that the more that people know, knowledge is power. We've learned that since we were kids. So absolutely. More knowledge. It's great.
And it's not that simple. We, as much as we're little 6-year-olds and we just I don't want to hear it all. Just give me the pill. Give me the magic answer. Here it is. Poof. Now go on your way. It's usually a more complex answer than that. And that means we need to be more educated ourselves. We need to be with people who are more educated, and we probably need to look at it in some sort of systemic, holistic. There's a lot of things impacting this, and maybe we got to change 2 or 3 things to make really the effect we're looking for. That's not where we want to be. I just still want a pill, and give me the answer, and I can leave and get back to the way I was here. You know, we live in a 60-second society. I got 60 seconds of my attention. Give me the quick answer here. The quick answer is go start by educating yourself. And give us one more time. Where do they go? There's a website for the other thing, PCCCC, or I don't know.
It's www.pcccrx.org.
Okay, extra C. There's the Physicians Cannabinoid Council. You put another C in there. Cause spell it out again. What is it? It's the
Pharmacist Cannabis Coalition of California. So it'd be www.pcccrx.org.
Okay. All right. There's information out there. We just got to find it. And sometimes it takes people like you bringing it to our attention here. So thank you so much for joining us. And I hope this was helpful. It was for me. I think you put it in. If nothing else, I learned there is a procedure. Start with natural, then go to, start with something you can eat or consume, then go to something maybe that's a plant-based thing you're going to eat or consume, and then go to a pill if you need to get there. But kind of start in that progress. I like that pattern. I think we all instinctively want to follow that anyway. Thanks so much for coming on, Princess Leah.
Thank you so much for having me.
You're you're the wizard of all this here. You're not a princess, you're a wizard. You're going to bring us all the magic answers here. Thank you so much for joining us.
Thanks. Have a great one.
Well, there you have it. That's the kind of information you can't get many other places here. So I invite you to join us each and every week for Health Talks as we talk through the complexities of our health and the multifaceted answers it gets us to where we want to go. All that and more on Health Talks with Dr. Trinh, streaming live from our studios here at the University of California, Irvine's Beale Applied Innovation Center.